Hello, everyone. This is Dr. George Gonzalez, and I'm here with a very good friend of mine, Dr. Woodrow Beck. And there's a hologram podcast, and we're here on the lake in North Carolina. And, Dr. Woodrow Beck has been practicing chiropractic for over 40 years, and he has such a tremendous amount of knowledge and experience within our profession and the healing arts profession in general. It's a tremendous wealth of knowledge, and I just wanted to share him with y'all, and so we could hear some of this wisdom, and it's so important because we don't hear a lot of this stuff anymore. We don't have the philosophy being taught in chiropractic schools anymore. We don't have a lot of the masters around that originally started our profession that Woodrow had the actual opportunity to work with and know personally. So, Woody, let's talk about, you've been practicing for 44 years, did you say?
44 years. I'm a proud Palmer grad, and I love philosophy, and I had the blessing of working with Dr. George Goodhart, Victor Strang, Virgil Strang.
Okay, yeah.
I call him Victor.
Got it.
And that's his son. And DeJarnay, Dr. Walker, just all Dr. Thompson, Gonstead, all of these giants in our profession, and Ted Mortar. The list kind of goes on, but I was blessed to be in an era where I knew these guys were the giants of our profession at that time. Dave Palmer was still alive when I graduated. That goes way back.
Did you meet him personally?
Oh, God, I worked with him at his home. Sure, I worked with his daughter Vicky. My wife got her some of her hand-me-downs. We were poor as church mouses back then.
Now, you used to be a janitor for the school.
For the school. That was my scholarship. And I worked at the home. I worked at little bit of heaven. It was just a wonderful life. I want to say something else while I'm talking here.
Absolutely.
I am a Palmer grad, and I'm proud of that. And my daughter's a Palmer grad. My son's a Palmer grad. My son-in-law's a Palmer grad. My daughter-in-law's a Palmer grad. Okay, so we're all Palmer grads, and philosophy is a very important part of success. You've got to know that you believe what you believe, and that's the way I feel.
I completely agree, and I was very fortunate to be in the very last class of Dr. Carl Cleveland II, who taught philosophy for us. And, when I first heard this stuff, it was like, come on now, this stuff's crazy,
Hey.
What does this matter? But when you're actually in practice and you're seeing people and you may not get the result that you're hoping for, it's that philosophy that one keeps you going, and that it's like you're doing the right thing when you're helping somebody's nervous system get well, and it keeps you focused on the direction of health.
Hey.
And what kind of things in philosophy are important to you, Woody?
Hey. I always go back to that crazy the cycle, the safety pin cycle. I can think of Vern Gillen teaching that, and Virgil Strang teaching you and I thought it was pure Mickey Mouse when I heard it the first time. And today it's still simplification, and a lot of people want to go into the specification of how that works and how this works. But believe me, it starts from inside out.
That's right.
And you've got to work on the nervous system to get the body to heal itself. It just is what it is.
It is, and when we see the great doctors that you mentioned, they all had that philosophical background behind them.
They all did. And back in those days, they didn't care what anybody said about, oh, you can't cure this, or you can't cure this, or you can't cure this. They just treated the body, and the body responds.
That's right. It's truly amazing, and we love our profession, and we've been talking this weekend about some of the amazing cases that you've seen over the years, and And with what you do, you have so many things. You do quantum neurology, of course, but you also do use magnets, you use fractal energy, you use all these different principles, and it's absolutely amazing. And we don't know what that pin is that's going to unleash somebody's healing. And so it's really important to have a nice tool belt of skill that you reach towards. And you know, of course, I would love it if quantum neurology was 100% of the answer 100% of the time, but it's not. It's a big solution, but there's always something that we can learn from other doctors, other practitioners, other ways of looking at the system that will help. Isn't that right, Woody?
I love it. I use lots of magnets, and the energy from the magnet is unbelievable, and I might even show you a little of that. But also it's simple as tying in Dr. James Sheen's sensory kit, which is magnificent.
It's fabulous.
You know, that you can tie in all kinds, and then of course you gotta include nutrition. You gotta include water. You gotta the normal things that we all know. You gotta have rest. You gotta have sleep. You gotta have all that's gonna help enhance the nervous system so it heals itself.
You know, we talk a lot about sympathetic, parasympathetic, Woody, and I know that's been an important part of what you do. Has that been a conversation the whole time you've been practicing, or is that newer?
No, that's totally new stuff. Parasympathetic, I didn't even understand hardly the difference between sympathetic and parasympathetic when I graduated. But it has become so important because as simple as different breathings, like holding your breath or panting. All of these are parasympathetic, sympathetic, and it ties in with our nervous system as to healing. And it's kind of like Dr. Ed Chauvin, you know, and his hummingbird. He's developed something that's magnificent in itself.
Absolutely.
And you can tie his in. It's all ties in with George's total philosophy of quantum neurology.
You know, it's so much fun to see Woody in action because ever since I met Woody, you were a high volume practitioner. You've done it all. You've done all the different techniques. You've done applied kinesiology. You've done BEST. You've done everything. And when I met you, you were a high volume practitioner.
My biggest day back in the day, 167 in one day by myself. And that was a pack a day by Parker. But that wasn't a normal day. You know, a normal day was 120. But 167 was a pack a day before I went to Parker. And I'm proud of that, but I couldn't do it today. It would kill me. And to be honest, when I first started learning with George, I used to tell him every time, I says, George, you're costing me money because you've slowed me down. Because I couldn't utilize all the stuff he was teaching me. But now, as I've grown into this wonderful profession, I can utilize it, and it's made me such a greater doctor. And there's nothing better than to helping your patients.
Absolutely. And I remember that first time we talked on the phone, and you're like, George, you know, you're slowing me down. I'm like, what are you talking about? How many patients have you seen? I said, how many patients have you seen? He's like, 80. And I said, wow, 80 is a lot of patients. He's like, yeah, and that's before lunch. I got another 80 after lunch. And I was like, that to me was just, I hadn't seen that kind of a practice before. So, you know, when you first started with it wasn't called Quantum Neurology originally when we started together.
GRT.
That's right. And you first started, and you said you didn't know how to do all this stuff, so you'd simply put, at that time it was a laser, just on the top of the head while they were lying down.
While they're lying down.
And you saw amazing things just with that.
And you could get, in my opinion, you could get approximately 5% of the balance just by putting the laser on the top of the head. While I had these treatment rooms, and I put a laser in each room on their head while they're waiting on me. Yeah. So that was balancing, that was all that red energy that was going right to their brain. And I think that was very beneficial, believe it or not, even if you do not do the work.
You know, we get together sometimes and we brainstorm, and I remember when I introduced fractal concept to Woody, and we were all sitting around the computer screen, we were watching the Mandelbrot set and all this stuff, and a little documentary on there. And Woody said the funniest thing. He said, I cannot believe that you find this interesting. Or I'm amazed at how you could find this interesting. And now he's one of the biggest energy, magnetism, fractal people I've ever met. And so tell us, what does that do for healing? What have you seen from that? Because you really have taken off in that direction.
Well, it just opens up every one of us as doctors, as good as we are, we run into roadblocks. And once you hit a little stumbling block, you need another tool to go a different level.
Right.
You need to level up. And I believe that you cannot have enough tools in your toolbox because that roadblock's going to come up. And I use magnets, and I use fractals, and I use colors, and I use vibration. And you just keep adding these tools. People always kid me around my office because I've got something in every pocket, and I'll pull it out. And the Q wands, I use those in one pocket. I got magnets in another pocket. I got my the sensory kit in part of one pocket. It's just, and I'll pull that out because once you hit that block, I don't know where to go, and you just keep doing it, and it's all energy frequencies and that work on the body. So you've got to find the frequency, if you'd like, that opens that channel for that particular person. And that's the way I think of it. And Absolutely. It just flows, boom, 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 boom.
You know, it's one of the things I talk about is how if you get poked in the eye, you're going to cover up that eye, and until you feel safety, you're not going to be able to take that hand away and then slowly let the light back into that area of your body. And the same thing happens throughout the nervous system, and all these different ideas that we're talking about, the frequencies, it's all about making the nervous system feel safe to expand itself back into its fullness. And it's fascinating when you start working with these concepts because ultimately our body is made of energy. And when we look at sensory especially, sensory is considered 80% of the nervous system. And to my knowledge, you know, quantum neurology is one of the primary ways to handle that. I'm not really too familiar with other ways of handling that. What have you seen with sensory rehabilitation in your office, Wood?
Oh, sensories, we use it now on almost every patient. My son and I, by the way, my son and I am the 7th certified quantum neurologist in the world.
One of the first 7, I'll say.
First 7.
Yeah.
Well, you give me my certificate, the 7th. Okay, and my son and I are the first father-son quantum neurologist in the world. And he practices with me also. But to get back to the sensory stuff, sensory is just knockout. Even if you just limit it to hot and cold, big deal. Or you can limit it to proprioception, you can limit it to vibration. Vibration's huge. So you can add any of these layers to your normal routine. And it's the same thing. It's kind of like George likes to talk about the terrain. So, like if you step on a nail, it doesn't just go in your foot. You might yell or you make a noise or blink or raise your leg. The whole terrain. And so if it's different frequencies for different levels. So that might affect the foot or the leg or the chest or whatever. So you tie those frequencies in, and like I like to keep saying, George taught us that doing the sensories in a simple manner, and Dr. James Sheen has taken that, in my opinion, to a whole nother level that a lot of y'all would really should take advantage of.
But then Woody has simplified not only the sensory work, he simplified all
I
of
try to
quantum
simplify it,
neurology,
even James.
you know, because he's a master practitioner that has made his living off of quickness. And even though, you have to realize I have to teach every single thing, I can't teach that quickness application like Woody's doing. And that's what he's going to be sharing at the homecoming event coming up in November this year. And we're really excited to have you there, Woody.
Hey, I love it, and I like working with these gifted doctors like Dr. Gonzalez or Dr. Ed Chauvin or Dr. James Sheen or all of these great doctors. But I usually have to slow them down and say, please tell me the simplified version of this so that I can incorporate it, and they know it, and it's great, and they can teach it to you, but I like to apply it the way it works for Woodrow.
Well, I'll tell you, don't let the southern accent fool you. Woodrow is one of the smartest men in the room, and I'll tell you why. It's because he keeps his mouth shut and he listens, and he asks for it to be explained simply, and then he's able to absorb that knowledge, and then he's able to put it into a speedier format that works for him in his office. It's tremendous. And you have one of the most unique offices I've ever seen. The first time ever I walk in, and it's no appointments.
No, I don't make appointments.
Have you always been that way?
Well, I started off, when I first started off, because I had to take lunch, because I opened from 8 to 8.
Wow.
5 days a week, because I was poor as a church mouse. And then on Saturday, we only worked from 8 to 2. So we didn't have time to do anything else. So we did make appointments back then. But after about maybe 2 years, we don't make appointments in my office, never have.
And people will just line up, and you'll see people poke their head in. Oh, the line's too long. I'll come back after lunch or something like that.
Well, that's what it used to be. It's a little slowed down now. But
yeah.
It's
a wonderful practice, and when I walked in the first time, everybody started saying, "Watch out for the elbow! Watch out for the elbow!" And so Dr. Woodrow uses certain moves, and one of them is his elbow, and he uses Mr. Thumpkin, and he gets pressure points on people like I've never seen. He was making me holler, holler.
I also consider myself an expert in the shoulder protocol and the hand protocol. So
every time I literally pray for the next time I'm going to see Dr. Woodrow so he can work on my thumbs. And as a hand working practitioner in chiropractic, this is our lifeblood right here, and he has a special way of adjusting this joint that's really made a tremendous difference in my life. And and he's a wealth of knowledge. I mean, we could sit and talk all day about all the different special techniques that he has, and it's truly amazing. Now, Woody, you've been doing this business a long time, and you started out poor as a church mouse, and,
Yes.
and you've done well for yourself.
Yes, I have.
God bless you, and you've earned every bit of that success. What would you say to newer doctors out there, or doctors that may be having a little trouble? How do they focus in on that target of a successful practice?
Well, the sad part about today, in most education costs so much that they start out in so much debt.
That's right.
It's crazy. But the best advice I can give to a young doctor is to focus on getting out of debt. And he's got to do that. He doesn't need that new car yet. He doesn't need that big house yet. He doesn't need that $8,000 cell phone. He needs to live a little frugal so that he can get out of debt, because eventually he's going to want to invest every cent he's got into his office, and that because the office is the thing that's going to make all those other things happen. If you can't do that, you'll never get above that. You've got to be able to get out of debt so that you can invest in yourself. That's the simplest advice I
Absolutely.
can give to anybody.
And keeping your overhead low.
All of the above.
And
You don't need all those. You don't need that special X-ray that's going to cost you $100,000. You might want it 10 years from then, but you don't need it now.
that's right. I've seen Dr. Woody coach some people, and just, students right out of school spending $70,000 to upgrade an office, and Woody's jaw dropping like, "Are you crazy? You haven't made a dime yet, and you're out spending money. You need to focus in." And what I tell people, and if I were to practice today, I would find an office suite, where I'm renting one room, and I would use that until I grow big enough to get my own space. There's no need to spend all this money in a space when you're not ready for it, and it's all about overhead.
Yeah, that's exactly.
You can make a
right.
wonderful living working out of a single room in an office suite, and then of course you could grow from there. And I've known doctors with 16 employees. I've known doctors that are single practitioners, and you'd be surprised how many single practitioners make more money than those huge offices, simply because they don't have the overhead. It's not what you make, it's what you keep. Ain't that right, Woody?
That's exactly right. And it's a lot like what George is telling you right there. It's kind of like you can have that small office, and then people are seen in your office. It's crowded even when you're first starting. It's kind of like if you got that small office and you got cars parked out in front, people see that people are in your office. That means that people say, "Oh, he must be good." They don't know if you're good or you're not good, but when they see cars there constantly, that means that people are coming. Okay, so that's a good thing. Hey, borrow some friends' cars and park them in your parking lot. Doesn't matter what you do, because I've had people actually drive by my office and say, "Wow, you got parking out. They're out on the street. What are you doing in there?" And they think I'm giving away stuff, and I am. I'm giving away health benefits, but those are just go around every place you eat. Drop off a business card. Put your name on it. Say, "Man, great job, Doc." Leave a decent tip, so that they will remember that card.
That's right.
If you skinty on the tip, they're gonna throw that card in the garbage. Just simple things like that. I mean, you'd think they don't matter, but they do. And in your hometown, if you're in a big city, you gotta touch somebody. You need to touch. If you're gonna touch the waitresses, touch the beauticians. These people talk.
They talk.
Your best friend, he's not gonna tell a soul. But all these people see people all day long. It's just those are little things that Parker used to talk about, and Yenny used to talk about, and all those. I used to go to Parker 5 times a year just to listen, because they were all giants.
Like I said, Woody listens, and that's why he's such an amazing practitioner. And when you, I really love Woody's life, because he works hard and then he plays hard. He's a champion tennis player, and you play tennis every
I wouldn't
day.
say a champion, but I was
Come
ranked
on.
number 8th in the state in the 65-year-olds. So,
Still.
But fortunately, my wife and I play tennis almost every day, and we love that. And we're blessed to have a wonderful lake house here. We're right outside of Pinehurst, the beautiful Lake Almond. And when we're out of work, we play.
And that's important.
We enjoy it.
That's
Yes.
important. So I know there's that nose to the grindstone aspect of what you've done, and that's the secret to your success. You've been working hard all these years, and like I explained to my daughter, it's like, look, this beautiful lake house here, it came at the cost of working your whole life to be able to live this kind of a lifestyle. But the important thing is, you started playing tennis when you were poor as a church mouse, and you've played every single day probably since then.
Mary and I didn't play tennis. We were at Palmer, and the back of the building that we lived in had a wall. And we'd go out there and hit the ball
Right.
against the wall because we didn't have any money. I mean, we'd do that for hours. Yeah, honestly, that was 48 years ago. Go. They, but that's.
But it's important to have your personal recovery, is what I'm trying to get at,
Oh,
right?
for
you
sure.
need to fill your tank, and for Woody and Mary, that's been a lot of tennis and a lot of fitness and exercise and
Yeah.
those kind of ideas, because you got to take care of the temple if you're going to be able to work as hard as you do.
I totally agree.
And you've been working from 8 to 8.
That was a long time ago.
Yeah, but you put in the time.
Oh, yeah.
And you have an amazing practice. You have a couple practices actually.
I actually have 2 practices
Yeah.
now. Like I said, my son and my son-in-law pretty much run those. My daughter and my daughter-in-law are also chiropractors, and my daughter kind of runs the business end of it. And I'm blessed to have all of those functioning and working
Absolutely.
smoothly for me.
Well, Woody, we absolutely love you, and we love what you share with everybody. It's wisdom, and I think people should, if you don't have that philosophy background, start learning the philosophy of chiropractic. Read the green books, right? And get that in there.
Or just listen to other successful doctors. And most every doctor that I've experienced, they have a philosophy. And that philosophy, all I got to do is just tell you a couple words of wisdom about it, and you think, ooh, that drives them. And then the word I love to have is passion.
Absolutely.
You have to have passion for what you're doing. And if you can encourage or instill, and the more you learn and the more success you have, the more passionate you become, because you learn, you get to see that this wonderful thing of chiropractic and neurology is the door that opens health for other people, and you get to share it, and you get paid for it. So it's a wonderful life.
It's a wonderful life. And the one other thing we were talking about this weekend is value. Creating value for that patient.
Value. You can't give it away. You can't give it away. I've tried. You can't go up and you be drinking at a bar and want to adjust everybody. They don't.
That's right.
Even if it works for them, they don't appreciate it, because they're going to want you to go to the bar and adjust them all the time. Are we about finished, George?
Just about, yeah.
Okay,
That's the last thing.
I used to teach for the state of North Carolina total office management. We called it TOM program. And the doctors volunteered, no charge, to go around to the new upstart doctors' offices to help them start their practice. And I used to teach. And when I would start my talk, I would always say, who in here wants to be a millionaire? And everybody would raise their hand. And I'd say, the best advice is to keep your first wife. And
Drop the mic.
And that has worked for me. And if you have a successful marriage, you're working together, you can accumulate a lot faster than you can when you start splitting it.
That's for sure.
I really believe that, and that wasn't
truth.
meant to be funny, but
It's
it's true.
It's the truth.
Because you get tired of supporting the lawyers and the exes. My exes are all in Texas. I'd leave them there. But go ahead.
We've seen, thankfully we haven't had that issue, but we've seen it in our friends and other people, family members that have gone through this.
Yeah.
It is a lot easier to figure it out and work it out than it is to let it all go. So, we thank you so much for being with us. Thank you so much, Woody, for sharing
buddy.
everything.
I love you.
So much wisdom and appreciation.
I love you.
And Dr. Woodrow Beck is going to be speaking at the homecoming event in November 2019. Really excited to have you there. He's going to be talking about hip and leg protocols and low back protocols streamlined using quantum neurology. We're really excited to have that. If you could be there, please check it out and check out the Hologram podcast.
That's good. That's fun, George.